So how do you get started with us? First of all, an information session is always the best way to start. We actually encourage you to attend one in person so that you can ask questions. But if you live far away and you watch this whole information session and you understand it, that can do the job as well. Because we do discuss all these issues again at consultation. We go over all of this stuff in the book as well. So beyond that, the information session, you come in and you see one of the surgical team. You always see a surgeon as well, but sometimes people start with a nurse. They want a little extra information that way, or an intake. Quite often our consultations are done in coordination with our physician's assistant as well. Everybody gets psychological testing. It doesn't mean we don't mean to be insulting or call anybody crazy. We just want to know where you are. People who actually have a mental illness have been proven to do better with weight loss surgery than people who don't have a diagnosis of a psychiatric disorder. Depression, bipolar disorder, certainly people do very well. We just want to make sure that you're stable. If you're going through the midst of a crisis, then we want to make sure that we're out of crisis period and that things have been stable for a reasonable amount of time. Certainly with chaotic life, if things are falling apart around you, this is not a good time, and we want to do everything we can to get you ready for surgery, but then wait until your life is stable. The same thing goes with chemical dependency. People who have been clean for a reasonable amount of time, and that does depend on the individual and what item they were using. But if you've been stable, certainly weight loss surgery can be very effective for you. But we don't want to go in too soon after instability. Everybody visits with a dietitian first of all, so that we can assess how you eat and what your problem foods are and what your behaviors are. And then secondly, so you can get education about how to best use these tools. The number of visits often is mandated by insurance. Some insurance companies require several visits. We also require everybody to be off cigarettes or all tobacco products for at least 6 weeks. And that is really a lifelong requirement. I will say that we're much more concerned after gastric bypass because of that ulcer issue. So what can you expect from us? You are, obviously, this is a very large medical part of your life. We cannot do this with partial information. We have to know basically everything about your medical history, especially your surgical history, and have coordination with your primary care doctor. It doesn't mean your PCP or primary provider has to be completely in agreement with surgery as a philosophy, but they do have to tell us things about you and your medical history and how they feel you'll be in terms of being compliant with visits and things like that. You can expect with any complex issues such as this some occasional delays and some frustrations. I tell people I have a hard time getting people on the phone in my own office, and they have trouble getting a hold of me sometimes. It's not any intentional disrespect. It is just a reflection of how complex the medical system is these days. And I do apologize when things are tough that way, but I don't expect you not to ever get frustrated, but please don't give up on us for those types of things. Now, that being said, letting ourselves off the hook a little bit for those things, we should never be let off the hook for respect and support from the surgical team or from anybody at the institution. There's never an excuse for any disrespect. There's never an excuse for any lack of support for us, and we work very hard for sensitivity training and to remind ourselves that we work for you and to give you nothing but the best feeling of being behind you and being your partner in this journey. Now, when you go home, when you go back to work, you can expect to need to educate people around you. There's so much bigotry and bias in society that you will need to talk with your family and friends about this. When they say something insensitive or biased against surgery, first of all, you have to remember that people are concerned about you and they don't want you doing things that they perceive as irresponsible or risky. And I think this is where you have the obligation, or at least the opportunity, to educate them. Most of people's fears are based on ignorance. They don't understand these issues. That's another reason we put this on the web, is so that you can help use us to educate your friends and family or coworkers if you feel they're supportive. If somebody's truly non-supportive and you don't want to have anything to do with them, that's your business. I understand that. But quite often, if somebody means something to you, it's important, it's better to try to educate them and help them understand what your rationale is and what the risks really are. You can also expect in life future challenges and changes. This does not solve everything. People do still have stressors. People do still have employment changes and relationship changes, and this is going to be a part of your life, and you will need to have it. You will need to adjust with it, and that's something that we're here for. Also, future challenges and changes in your health. We are all going to die of something someday. We're all going to get some type of diseases down the road. When you talk to healthcare providers, whether in an emergency room or with your primary docs, if you change down the line or move down the line, you need to let them know that this is a part of your health and a part of your body, and they will have to be aware of that and make adjustments consistent with that. Okay, so risk benefits, here are the alternatives. There's not a lot. First of all, you've probably already tried diet and exercise or medications. You could try that again. If you've never tried them, we certainly encourage you to try. And most insurance companies require it. Now, we know that 99 out of 100 people are not going to have long-term success. But still, if you're that 1 in 100 person or 1 in 1,000 persons, that's a great way to go. I have nothing against that at all. If you want to just give it one last try, we have a medical weight loss program, and we're happy to help you with that. A lot of people do really feel like they want to give it one last try, and I don't think there's anything wrong with that. This is not a rush deal. I tell people it took me 10 years to decide to have LASIK surgery on my eyes, and I'm glad that I took the time. I didn't do anything differently in the end, but I waited until the time was right for me. I think you should feel the same for yourself. There are some unproven experimental procedures out there, and I don't use those words negatively. They just have not been proven to be effective, and they are still in the development stage. They may never prove to be effective, or they may prove, if they find things exactly right, that or the perfect recipe, that they may be the next great thing. I will tell you that the pacemaker has been looked at fairly extensively so far, and long-term it just does not seem to be working for most people. There were very early promising studies, but again, in terms of the durability, in terms of lasting a long time, it did not seem to work at this point. Studies are still going on with that, but I'm less hopeful about it than I was even a year or two ago. There's a new procedure called an intragastric balloon that is a little balloon that just sits inside the stomach. It goes in non-surgically. It works very well for the short run. We are definitely sure that it is not a long-term thing. We cannot leave that in place forever. But it is good for the short run for a lot of people. It has its own complications as well. Probably coming to the United States in the next couple of years. There are some other advanced procedures that are being developed. They're very unproven at this point in terms of truly non-surgical techniques that are just done through an endoscope. The other alternatives that we don't perform here, the severe malabsorptive operation, that duodenal switch, or biliary pancreatic diversion, or scope and narrow procedure if you're reading on the internet. Those are available out there. I don't think they're irresponsible, but I do think risk-benefit wise for most people, once you understand the differences, most people are not going to choose that. We can give you the names of some people who do perform those, or you can find them easily on the internet. We don't do formal referrals for that. The vertical banded gastroplasty is still being done in some centers. I do recommend against that. It's just not as good a procedure, and we have techniques that are as low risk as the VBG with less of the risk of weight regain or breakdown of the tool. So it's done out there. Most centers who do it do other things as well, and I just wouldn't recommend having that procedure. I'd like to thank you very much for your attention today. At our regular information sessions, we have questions. Sometimes we stick around for an hour answering questions. Sometimes it's just a few minutes. I always stress that individual issues, sometimes when we have to look over your medical history or your exam, can really only be answered in the consultation room at the time of examination. But a lot of times we talk about insurance issues at this point, individual health issues. laparoscopy in particular. People want to know if they've had prior surgery or hernias. Can they have laparoscopy? And the answer is usually yes. I'm quite liberal about at least having a look laparoscopically. We can divide adhesions and things like that with laparoscopy. It's certainly not often that we have to go open, but that's something we talk about individually. Medicare coverage in our program is likely, we hope, by the spring of 2007. We're still undergoing that process, although we are very close, we hope, to accepting Medicare. People who live greater than 60 miles away, Duluth has a large number of people who are quite geographically distributed. The main reason I put this on, especially historically, was for people who have gastric bypass. If you end up out of the hospital a day or two after surgery, I ask that you stay in town close by for at least a few days. I used to put a drain in everyone that was pulled out at a week, and so I asked people to stay until the drain came out. You just need to be aware that things are not completely healed for a good 3 to 4 weeks after surgery, and certainly that first week. I think it's just better if you live more than an hour's drive away, that you stay closer in town. There are some good hotel rates in town. This is true even for the band folks. If you want to stay in town for a few days, it's not a bad idea. So just to be aware of that. Anyhow, that's the basics. We can, again, reinforce or elaborate on any of those issues, and we do go back over all of these issues at your consultation with the surgeon. It's always a good idea to bring family with you, or whoever your supporter is, because this is obviously a lot of information, and even going back over it, it becomes overwhelming very quickly. So I ask if you have someone who you're comfortable bringing with you, to go ahead and bring them with you at the time of consultation as well. Thanks again.